Let's talk about enterotomy. Enterotomy is the surgical incision into an intestine. The named patient is Bulding, a 1-year-old male puspin weighing 2.5 kilos. Indications are foreign body removal, full thickness intestinal biopsy, and linear foreign body removal. Surgical anatomy. The small intestine of the cat constitutes a simple continuation of the alimentary canal from the stomach to the large intestine, consisting of the duodenum, jejunum, and ileum. The upper small intestine is primarily secretory, and the lower small intestine primarily absorptive in function. The major duodenal papilla typically receives the common bile duct and major pancreatic duct, whereas a minor duodenal papilla is only present in cats, in which an accessory pancreatic duct persists. The arterial supply to the small intestine is via branches of the cranial mesenteric artery, and venous return is primarily by the cranial mesenteric vein, a major tributary of the hepatic portal vein. The intestinal wall consists of an outer serosa formed by visceral peritoneum, the tunica muscularis, with its outer longitudinal and inner circular layers. The submucosa, which is rich in collagen, also serves as the principal holding layer for sutures. The intestinal mucosa is lined by simple columns of epithelial cells mixed with variable population of mucus providing goblet cells. One distinguishing factor in cats is the presence of prominent lymphatic nodules in the mucosa, mostly along the antimesenteric aspect of the small intestine.
Preoperative technique. So the operating room needs to be prepared and was prepared aseptically before the surgery. The instruments, drapes, towels, and scrubs were autoclaved. The patient was fasted for at least 8 to 12 hours before the procedure. It was batted and removed. The matted hair was removed to prevent contamination. So, minutes before the surgery, we shave or we clip the site where the administration of anesthetics and fluids, and as well as the surgical site. We administered pre-anesthetics, atropine sulfate, but before that, we note the vital signs such as the heart rate, respiratory rate, and rectal temperature. After a few minutes, we gave or administered general anesthesia, which is Zolitol 50. And nung nakatulog na or na medyo sleepy na yung pusa, we gave IV fluids. Tapos, nung nakatulog na, nakabit na yung fluids, we position the animal in recumbent position, which is dorsal recumbency. We cleaned the operative site with hydrogen peroxide and povidone iodine. And after which, we put the drape and we secure it with towel cloths. Per-operative technique. Yung operative site, tapos during clipping ni Bulding.
So let's go now to operative technique. Make an approximately 5 cm central midline abdominal incision in the abdomen. Use retractors to retract the abdominal wall and provide adequate exposure of the intestines. Exteriorize the desired intestine from the abdomen by packing with towels or laparotomy sponges. Gently milk time or the intestinal contents from the lumen of the identified intestinal segment. To minimize spillage of the chyme, occlude the lumen at both ends of the isolated segment by having an assistant use a scissor-like grip with the index and middle finger 4 to 6 cm on each side of the proposed enterotomy site. If an assistant is not available, use non-crushing intestinal forceps or Doyen, or a Penrose drain tourniquet to occlude the intestinal lumen. Make a full thickness stab incision into the intestinal lumen on the anti-mesenteric border with a number 11 scalpel blade. If a foreign body is present, make the incision in healthy appearing tissue, distal or aboral, or proximal to the foreign body. Lengthen the incision along the intestines, long axis with Metzenbaum, scissors or scalpel as necessary to allow foreign body removal without tearing the intestine. Transverse enterotomy incisions can also be made to obtain for intestinal surgery. Biopsies rather, but is not recommended for foreign body removal. Use for polydioxanone or polyglyconate suture. Never use chromic gut for intestinal surgery. Close the enterotomy with simple interrupted appositional pattern sutures and place through all layers of the intestinal wall, 2 millimeters from the edge and 2 to 3 millimeters apart, with extraluminal nuts. Angle the needle so the serosa is engaged slightly further from the edges than the mucosa to help prevent mucosal eversion. Tie each suture carefully with apposition without cutting through the serosa layer of the intestine. Sutures should be tied just tight enough to oppose all layers of the intestine. Before releasing luminal occlusion near the enterotomy leak, test the enterotomy by tunneling a 20 to 22 gauge needle into the lumen of the intestine and injecting sterile saline into the lumen. Inject just enough saline to distend the enterotomy site. If leakage does occur, place 1 or 2 more sutures and retest the enterotomy site for leakage. And lastly, wrap a small amount of amentum around the enterotomy site. This will help seal the enterotomy site. For the muscles, use a PGA with a simple interrupted pattern. Make an intradermal suture with caching pattern and Aberdeen knot for more security of the abdomen. Lastly, affix the skin with a simple interrupted pattern. Okay lang. Ito yung during operative, yung linagay namin yung probe director kung malaman kung nakapasok na yung sa lumen. Tapos dito yung first na-insize namin yung abdomen. Nung nahanap na namin yung intestine, tapos yung nung na-close na yung abdomen.
For the post-operative, so after no surgery, of course, we clean the site again using povidone iodine and hydrogen peroxide. Tapos, nagbigay kami ng antibiotics. Una, nagbigay kami ng penmycin IV and tolfine. Nagbigay din kami ng multivitamins and iron supplement. Tapos, nung pwede nang mag-oral yung cat, nagbigay kami ng Coamox for 10 days and anti-inflammatory drugs was given every day. For the surgical incision, we made sure na nililinis namin ito with iodine and hydrogen peroxide. Tapos, for the first week after the enterotomy, the patient was given a soft diet. So, yung soft diet, cat food lang din na binabad namin sa water para maging soft siya. Tapos, after 14 days, the suture will be removed.
The complication. The biggest complication associated with an enterotomy procedure is dehiscence leading to septic peritonitis.